I'm Pat Doris. Welcome to The Story, and welcome to Friday. It's the first Friday of summer. You know, Portland has had drug problems, but they're out of control on our streets now like we've rarely seen before. And so Portland's mayor has decided it's time to do something about it, or at least to try. And that is our big story tonight. Next week, Mayor Ted Wheeler will ask his fellow council members to vote yes on a change to an existing law. He wants to expand the city law that makes it illegal to drink liquor in public to include using drugs in public. The current law is found in the Portland City Code, Chapter 14A.50, Conduct Prohibited on Public Property. Skip down to 14A.50.10, and we'll find that this law was last changed in June 17th of 2011. It reads that it's unlawful for any person to drink alcoholic liquor upon any street, sidewalk, or other public right-of-way. Now, if the mayor idea passes, the lawyers will insert a few lines in there. The new ordinance would read, it is unlawful for any person to drink alcoholic liquor or to consume a controlled substance as defined by ORS 475.005 upon any public property or any street, sidewalk, or other public right-of-way. By the way, in case you're wondering, Section C of that city law makes it clear that sidewalk cafes and places with licenses, they're exempt from that alcohol prohibition. But let's stick to the topic, which is drugs. Portland Mayor Ted Wheeler apparently not interested in holding a press conference where he'd have to defend his plan, instead issued a video statement on the idea. Here's part of it.
Portland's growing substance abuse problems have exploded to deadly and disastrous proportions. This year alone, Portland Police Bureau has already initiated over 100 suspected overdose death investigations. According to data from the National Survey on Drug Use and Health, the state of Oregon ranks #1 in the nation for adults and teens reporting an illicit drug use disorder in the past year.
Now, I don't know about you, but I'm instantly suspicious when a mayor or any politician chooses to skip the press and just release a statement like that. In my opinion, we should and do expect more from our leaders than a canned statement on video. At the same time, the information is worth considering. More than 100 overdose deaths in the city of Portland in the first 6 months of this year. That's an average of 4 people dead from drugs every week. So, is there a problem? Yeah. Measure 110 decriminalized small amounts of hard drugs, but it seems the impact has gone much farther than that as open-air drug markets spring up around Portland. The mayor says it's time for change. While it may be legal to have small amounts of drugs, he wants to make it illegal to use those drugs in public.
This is a common sense approach. We must make it clear that people cannot use drugs in public spaces. I appreciate that this ordinance has support from the Portland Police Bureau and the Multnomah County District Attorney's Office, but it's going to take all of us working together to make the kind of systemic change our city desperately needs.
If approved, violators of the new city law could be fined as much as $500 or get 6 months in jail, or maybe both. Prosecutors in the courts would have the final say, but of course, the city also said that alternatives to criminal punishment will be used. Which brings up the question of, will there be actual consequences? I mean, I guess we'll see. But that's a discussion for another day if this proposal passes. Anyway, what do the frontline workers think about this? And by frontline, I mean the cops who deal with open use of drugs all the time. Well, I had a chance to talk with their union leader, Aaron Schmautz, today. He is also a veteran Portland police officer. He says the ability to arrest someone is a good last resort.
So, I mean, I've said a couple times, we're never going to arrest, and we shouldn't arrest our way out of an addiction problem that is, at the core of itself, a health issue. But people who engage in narcotics use on the street create some livability issues. They also very often engage in low-level criminal conduct to support that habit. And so, you know, when police officers are out in the street, you know, I've been working with some different treatment teams to figure out how we can get some, you know, quick resources to police officers. We need to be focused on getting people into treatment. If we have people on the street, however, who are resistant to that treatment, who are daily engaged in conduct that is creating police calls, that is creating safety issues, that's where that enforcement comes in. So I do think having a model that doesn't just focus on, people call the police, we show up, we arrest people over and over and over again. I think that is just as frustrating to people when they feel like there's this kind of like cycle. Police officers should not be thinking and are not being directed to go and just start arresting people based on this program.
Well, and I've talked to folks in the criminal justice system who say that the ability to arrest somebody and put them in jail, at least for a little bit in the past, has been effective in getting people into the drug treatment programs because they're not making good decisions when they're on the street and under the influence of the drugs.
Yeah, 100%. I mean, there was a town hall that I did earlier in the year where a mother who had lost her son to addiction on the streets of Portland, she was just weeping afterwards and saying, she said to me directly, the only time I knew that my son was alive was when he was in jail. And that's tragic. And to me, that is a bigger indication of the holes that exist in our service community, and of just the real depth of despair that exists for a lot of these families and for these people who are experiencing addiction. I truly believe there are times when people are so acutely ill and so stuck in this cycle of abuse that they just need a break. They need a stopping point. Now, we don't have detox right now. We don't have really a place to take people, and we need to make sure we have those places. And also, when people are so either psychotic as a result of their drug use or just unable to stop, I think a program like this, where police do have that ultimate kind of backstop of, look, if you won't stop, we're going to have to stop you. We're going to have to do something to break this cycle. I think that is an important component in a system.
Finally, our night crew took to the streets last night to ask people what they think about the idea. Is it a good idea to make public drug use illegal? Would it cut down on crime?
And I just feel that we can't just make a measure and think that's going to fix everything. We've got to have support. We've got to have other things in plan. So now what? And that's more what makes me, like I said, it brings more pause and more questions to, okay, a measure is passed, now what?
Yeah, I would say so, especially shoplifting. Shoplifting is a huge thing in Portland, I know, and especially by drug users of all kinds.
I think that having it illegal in public would honestly be really beneficial. I've never really been a huge fan of drug use in public in general.
So some interesting thoughts there. The mayor will introduce his plan to the council next Wednesday, and of course we'll be watching. And I know, I said finally before, but I'm not done. But now I want to ask you about this. Send me an email, will you? Share your thoughts. The address is thestory@kgw.com, or call and leave a voicemail, 503-226-5090. I look forward to hearing from you. And while the Portland mayor's proposal is targeting all kinds of open-air drug use, fentanyl is obviously the big one. Lawmakers in Salem have now passed a bill to crack down on that drug. Right now, Oregon law does not have a Class A misdemeanor charge for possession of fentanyl. It does for other drugs like heroin, meth, and cocaine. Also, Oregon law requires proof of specific quantities of fentanyl, defined by weight and not by possession of pills, tablets, or user amounts, which is allowed for things like oxycodone. This new law changes all that, fixes it. House Bill 2645 received bipartisan support. It passed the House on a 52-1 vote and coasted through the Senate this week with a 25-0 vote. 5 Republican senators, by the way, are still walking out, and they did not vote. It now sits on Governor Tina Kotek's desk, awaiting her signature. If she signs it, the bill will take effect immediately. So here's what it will do. Anyone found with 1 gram or more or 5 individual doses of fentanyl can be charged with this Class A misdemeanor. The penalties that kind of charge carries are up to 364 days in jail, a fine of just over $6,000, or both. Advocates say the bill will take fentanyl dealers off the street. The Oregon Health Authority says in 2021, nearly 1,300 people across Oregon died from a fentanyl overdose.